Hey, so this is my sister, and I'm just using her as my prop for today. So the first terms that I'm just defining are the right versus left. So this is her right side. This is her left side. The next is proximal versus distal. And her elbow is proximal to her wrist, and her wrist is distal to her elbow. The next two terms are medial versus lateral. So her arm or her wrist is lateral to her breastbone, and her nose is medial to her eyes. Superior versus inferior. Superior would be like her chin is superior to her navel, and her navel is inferior to her chin. Anterior versus posterior. Anterior would be like her navel is anterior to her spine, which is on her back, so it's in front. And the spine is posterior to her breastbone because it's in the back. Next is superficial versus deep. And superficial would be like the skin is superficial to the muscle because the muscle is inside, so it's on the surface or towards the surface. And deep would be as far as the lungs inside the ribs, which we can't obviously point to. Next are the planes. So the frontal plane, the frontal plane divides her right here, And then the next one is sagittal plane, and that just cuts her completely in half. And then the next is transverse plane, which cuts her right here at the chest. The next things are the quadrants. So this is the upper right quadrant, and this is the left upper quadrant. This is the right lower quadrant, and this is the left lower quadrant. This is the right hypochondric region, and this is the left hypochondric region. This is the right lumbar region, which is right below it, and this is the left lumbar region. And then at the bottom is the right iliac region and the left iliac region. And then down the middle, we have the epigastric region, which is at the top, the umbilical region, which is in the middle where her navel is, and the hypogastric region. And so that completes all of the terms on the list. Have a good day.